Hello everyone. As schools are starting again, a good conversation to have or a good topic to discuss is childhood obesity. Today, children face a wave of temptations, and that includes screen time, sedentary behaviors, unhealthy snacking and unhealthy meals, and this is all leading to childhood obesity. Childhood obesity is as severe or as problematic as adult obesity, wherein it leads to heart disease, type 2 diabetes, and several other health complications. And since we cannot really control the environment we live in, a good place to start with the treatment or the prevention of obesity is at home. And so the first strategy I would recommend to families or parents is to focus on the diet. So one thing I always mention is how the more colorful the diet, the more healthy it is. And usually when I'm talking colorful, I'm referring to natural foods, so vegetables. The more colorful they are, the more vitamins you're providing your house, and the same applies to fruits. Whole grains over refined grains, this provides more fiber and more phytochemicals. And then another thing to talk about is portion sizes. A lot of parents want their children to eat as much as them, and which usually comes from a good place. However, this is also leading to childhood obesity, as children cannot eat as much as an adult. So controlling portion sizes and choosing better is a good strategy. Another thing is to be more aware of food labels. There's sometimes some tricks and turns with each food label. However, a good way or a good thing to focus on when you're reading food labels is sugars and sodium. You can also look at other things if that matters to you, but the four things that people usually focus on are trans fat, saturated fat, sodium, and sugar. The less, the better. Moving on from diet, physical activity. I would recommend limiting screen time with physical activity. So take your children to the park or establish a family walk every Tuesday, for example. So this will basically help foster more healthy family timings along with exercise, physical activity. Physical activity could help control satiety cues, which is basically your hunger and your being full to hunger type of cue, and exercise. And it's helping with exercise. Another thing is family meal time. So children mimic parents. So if the parent is eating a meal, the children's more likely to copy it. It's very difficult for a child to eat healthily when the parents are not following that. So at the very least, do it behind their backs. Another thing to look at is sitting time. So today, because of the weather or even because of our environment, we usually have longer sitting hours than we do for standing up. We can also develop family challenges, so whoever walks the longest or whoever has the longest or the highest number of steps, whoever has the least sitting hours wins. And the prize could be family-based, whatever works for you guys. And so this is a good way for families to work together with healthcare practitioners to combat obesity. The aim here is to develop nurturing and healthy or foster healthy environment. Let's work together to combat obesity or type 2 diabetes by promoting healthy and a nurturing environment for children. And if you guys have any questions, feel free to reach out or to check out our social medias.